I'm a pharmacist, my wife's pregnant, who's also a pharmacist, and I'm going to tell you why we will still continue to take Tylenol. One of the biggest concerns that Tylenol will help out with in pregnancy is fever. If that fever goes untreated, you increase your risk of having a miscarriage, birth defects. Even further, it can put you in the ER. And if you know anything about an ER, that is a breeding ground for illnesses, which is where you do not want to be if you're pregnant.
Let me just say this about the announcement concerning autism and Tylenol. If you don't have a problem with the fact that the Bill Gates Foundation funds like 60% of the world's healthcare initiatives and that they funded the COVID vaccine, you don't have a leg to stand on when it comes to Dr. Oz and his Leucovorin. And you should also not have a problem with their action plan that they put out to address this issue because, like Trump said, there is virtually no risk in anything that they suggested.
If you are the parent of a child with autism and you happen to take Tylenol during pregnancy, I want you to know that you did not cause your child autism. If you are pregnant right now and considering whether Tylenol is safe in pregnancy, I want you to know that the best available science does not show an association between Tylenol use in pregnancy and an increased risk of autism.
Pregnant moms across America are asking one urgent question. Does Tylenol cause autism? The headlines are scary, but what's the real story behind the claims? Hi everyone, Dennis Njoroge here. Welcome back. Quick disclaimer. I'm not a doctor. All medical clips featured here belong fully to their original creators, and I share them here for commentary and discussion. Much appreciation to the doctors and the experts who helped break this down. If you're pregnant right now, you're probably more careful than ever about what goes into your body. Tylenol is one of the most common pain relievers doctors recommend during pregnancy. But lawsuits and studies are now questioning whether it might be linked to autism or ADHD in children. That's enough to make any expecting mom nervous.
Much of the acetaminophen given for low-grade fevers and just given routinely, mindlessly, without even thinking why we're giving patients the option to not take it. Much of that, I think people deserve to have the information to know that there are some doctors with concerns, including the dean of the Harvard School of Public Health, who made a very clear statement that there is a causal relationship. I'm reading now from the statement of the dean of the Harvard School of Public Health. There is a causal relationship between prenatal acetaminophen use and neurodevelopmental disorders of ADHD and autism spectrum disorder. We felt an obligation to get this information out to everyday docs.
Hi, my name is Dr. Rubin, and I'm going to clarify some of the misleading statements by the Trump administration, particularly what the FDA Commissioner Marty Makary just said in terms of the potential association between acetaminophen, known as Tylenol, during pregnancy and children developing neurodevelopmental disorders like autism spectrum disorder. We need to critically evaluate the claims that the Trump administration is saying by looking into the literature that they are citing to see whether there's actually true merit to say that there's a definitive causal link between acetaminophen use during pregnancy and children developing autism spectrum disorder. And the first thing that pops up is the fact that there's potential conflicts of interest. The study author that they keep citing has been reported to have taken $150,000 as an expert witness in a Tylenol lawsuit, which right then and there will tell you that there may be something else going on that we're not aware about. So let's look at this study because this is what they're using to try to fearmonger people right now. So make sure you're sharing this post widely so people get a really in-depth view on what's going on here. It's a systematic review. They took 46 other studies together to try to draw conclusions from it, and they're all observational studies. We know that Marty Makary and his other pals like to talk about randomized controlled trials, but none of those are actually in here. What they mainly rely on is maternal recall of how much Tylenol that they were using during their pregnancies and if the children develop different neurodevelopmental outcomes like autism spectrum disorder. And I'm just going to ask you point blank, can you remember what you had for dinner 5 years ago? That's one of the issues which is called recall bias, that if you're going to ask somebody what medication they were taking during their pregnancy, especially if it wasn't during the actual pregnancy, they're not going to necessarily reliably be able to remember it, especially if their children did not develop autism spectrum disorder. If they have a child with autism spectrum disorder, they're more likely to try to think about all the potential reasons why their child developed this neurodevelopmental disorder. And so there's going to be some skewing of results towards moms who have children with autism spectrum disorder remembering that they actually took Tylenol compared to people who didn't have children with autism spectrum disorder. They're not going to necessarily remember it. In addition, many of these studies don't tease out some of the important confounding factors, meaning there are other issues that could distort the actual relationship between Tylenol use in pregnancy and developing autism spectrum disorder. It's like saying there's an association between the number of Nicolas Cage movies that come out and the number of pool drownings. They have nothing to do with each other, but you can see that there's actually an association between the two. And when it comes to Tylenol use in pregnancy and developing autism, there are reasons why mothers take Tylenol during pregnancy. It's the only safe antipyretic or fever-reducing medication that can be used. And so if mom has a fever, we know that's highly associated with children developing congenital anomalies. So we need to make sure that that is properly controlled, which many of these studies don't do that. What this study did not do was properly control for genetic factors, which there was a study out of Sweden that actually did that with 2 million children, and they were showing that that actual association disappears when you actually control for genetic factors. There's also quite a bit of variability amongst these studies in terms of how the outcomes were actually measured, and so being able to draw a conclusion to say that Tylenol use in pregnancy causes autism is a bit of a stretch. And even let's say this was theoretically possible, most folks believe that it would be just a minor component compared to the grand picture of things. So for the President of the United States to tell moms to tough it out and never take Tylenol during pregnancy is extremely harmful. Now, I always believe that in medicine, it's important to do more with less, but that doesn't necessarily mean that you should tough it out, and always talk with your doctor if you have questions and concerns about your health. But it's really important that when we have public health messaging, that we actually give as accurate information as possible that is nuanced, rather than these catchy sound bites that are going to scare people away from something that's known to be safe and effective. The alternatives of not taking the medication when needed could be potentially devastating in cases, and we don't want to create that unnecessary harm. So if you are interested in learning more information like this from a nuanced approach, you can feel free to follow me on social media, but I always recommend that you talk with your doctor to really know more about your personal health.
Well, here we go. Why is it every time I try to get onto TikTok after COVID, some other crazy, terrible medical conspiracy thing gets launched into the stratosphere? Some of the things that we struggle with as physicians is that there is a culture impressed upon us at a very, very early age in our training to keep our heads down and to just see patients and to work hard. You don't call in sick, you don't complain, you work harder than the next person beside you, and you just keep taking care of patients. It's a noble profession. The problem is there's a pressure to not speak up when things like the announcement yesterday about Tylenol and pregnancy happen. There's a lot of politics involved, and physicians are pressured to be quiet. The problem is, when you do that, and we are the experts in medical practice, you allow misinformation to take over. You allow politicians to manipulate the internet, and patients suffer. And of all the people in society that are most responsible for patient safety, it's physicians. Ethically, legally, morally, it all rests on our shoulders. We're the ones who make the final decisions. We try to give the best advice. We've been trained to understand statistical analysis of evidence-based medicine and then apply that in the proper format and context for our patients. That's how everything in medicine works, everything. Do you want to know why we use epinephrine the way that we do in cardiac arrest? It's because of literature. Do you want to know why we focus solely on continuous chest compressions as the number one leading factor in survival in cardiac arrest? Evidence-based medicine. Why do we know that Augmentin works well for streptococcal pharyngitis? Why do we know that macrobid helps in very simple UTIs in young patients? Why do we know certain chemotherapeutic agents work against different cancers? Why do we save lives every day? Evidence-based medicine. There is no evidence, there is no large, multi-center, double-blinded study proving or showing any correlation, any direct cause and effect, I should say, between acetaminophen or paracetamol in other countries and development of autism. Autism is complicated. Genetics is a huge, overwhelming factor. And most people agree that there's multiple variables involved. For you women out there that took Tylenol during pregnancy and you have children with autism, it wasn't the Tylenol. You didn't make a bad decision. There's no evidence that supports that. And for you women that have fever right now because you have pneumonia, take the antibiotics and take the Tylenol. We know why you can't take NSAIDs. We know why you can't take Motrin or things that impact how the vascularity of the pregnancy is able to provide and nourish and oxygenate your baby. We've known for a long time why not to use NSAIDs. Autism was described decades before Tylenol was released into the world. So for decades beforehand, we had autism. Historians can go back in time and look at people that were clearly described as being autistic. So it's been around since mankind. Tylenol is new compared to the thousands and thousands of years history of autism. Autism was described and delineated in the early 1900s as a separate diagnostic entity with a formative means of conceptualizing and being consistent in applying that diagnosis to patients. So I get the need and the desire to understand what causes autism. We would all love to find the means to avoid anything that we feel may make our children's lives difficult. It's very emotional. So we should always look, we should always evaluate. But there is a point in time when you've had multiple studies for decades and a recent large study that shows no causation between Tylenol and autism. You have to finally sit back and go, this is the evidence. This is evidence-based medicine. It's very difficult to talk about this without things getting political. I will say this. We're at an impasse as a country, obviously. I love this country very much. I served 9 years in the Army. I've taken care of every single kind of human being on this planet. And I've always applied the best evidence-based medicine I can to every single person. And I don't like politics, and I don't like confrontation. But I will say this. One of the things that I admired about Charlie Kirk and Bill Maher and all other kinds of people that sit down with opposing views and have relaxed conversations is that they were willing to have the potential for confrontation underneath the auspices of civility to try to find the truth. So I won't be name calling. I'm not going to be jib-jabbing with people in the comment section. But Tylenol has not been proven and has actually been disproven multiple times to be directly related to the development of autism. And so I do think it's disingenuous. I do think it's upsetting. And I do think it is a falsehood to allege otherwise. Every single professional organization in the world is coming out against what was released yesterday at that press conference. Not because anyone's getting money for Tylenol. Tylenol is generic. It's old. There's no money involved here. But we are aware that there are women that are suffering. And sometimes fever in pregnancy can actually be more harmful than anything else. And so take the Tylenol. Treat the pyelonephritis. Treat the pneumonia. Treat the flu. Take care of yourself. That takes care of your baby. And follow the evidence. Everything that I do with the EMS protocols I write and protocols I write for emergency departments, it's based on evidence, it's based on science. And if the science changes, and if there's overwhelming evidence that says otherwise, then it behooves all of ourselves, myself included, all of us in the medical community, to follow that best practices. But when no such thing exists, we are not going to change our practice because we know what works for patients and we know what's safe for them. So I will still be prescribing Tylenol-based medicines. The ACOG, the pediatric colleges, the maternal fetal medicine colleges have all put out statements that are out there. There's tons of literature out there if you want to read it yourself, but Tylenol is safe in pregnancy. We will continue to use that to treat our pregnant patients. And this puts us, unfortunately, at somewhat of a contrarian position to the current government, and that's disappointing. I wish you the best. I'm sure there's going to be a lot of debate about Tylenol in the comment section, but let's keep it civil. Let's stick with the evidence. Let's not jump on the conspiracy train to Area 51. Let's try to stick with the science and the evidence and review it from all sources. I wish you the best. Be kind to one another. Until next time.
Let me just say this about the announcement concerning autism and Tylenol. If you don't have a problem with the fact that the Bill Gates Foundation funds like 60% of the world's healthcare initiatives and that they funded the COVID vaccine, you don't have a leg to stand on when it comes to Dr. Oz and his Leucovorin. And you should also not have a problem with their action plan that they put out to address this issue because, like Trump said, there is virtually no risk in anything that they suggested. For instance, the first thing is they're going to issue a physician notice and initiate a safety label change on acetaminophen, which means that Tylenol will still be available to you. No one's taking your Tylenol away. They are just giving you a label so that you know the risk of taking Tylenol. They will launch a nationwide public service campaign to inform families and protect public health. They are literally just giving you information. You can take it or leave it. You can do whatever you want with that information. Then the next thing they're going to do is establish the first recognized therapeutic treatment for children with cerebral folate deficiency and autistic symptoms, which is going to be Leucovorin. So again, this is just an option that is offered to you. They are saying this is a treatment that is available to you. You can take it if you want. You cannot take it if you don't want. And if you are on the left particularly and you care about people that are on Medicaid and you care about these government programs and assistance programs, this should be the most appealing to you, that per FDA action, state Medicaid programs will be able to cover this treatment for autism spectrum disorder. They made sure specifically that the low-income people and the less fortunate people would have access to this treatment first. And they said that they hope that the private companies will follow suit. Just FYI, there goes your entire narrative that Trump was only going to make his treatments available for the rich people and the elite and the private companies, because no, he didn't start there. Then, of course, as is customary, there are going to be trials and new research into the impact of this new treatment, as there should be. And also, just side note, while we're on the conversation of state Medicaid programs and Trump and Maha, if you were under the assumption that Trump is trying to take away money from these programs, let me tell you something. RFK Jr. also announced around the same time that they are going to be adding another $62 million to Medicaid and SNAP programs in order to promote healthy eating, healthy choices, and healthy nutrition information. Not only that, but the third step is increasing research investment. So through the Autism Data Science Initiative, NIH will fund 13 projects totaling more than a $50 million investment to transform autism research. Another thing they mentioned during this meeting was splitting up the vaccines, going back to taking one vaccine in small doses over a longer period of time. There is almost virtually no risk to doing that. And before anyone decides to twist that, okay, they are not saying that you should just decide to get these vaccines whenever you want to. There is still going to be a vaccine schedule. However, they are probably going to modify it and maybe stretch out the amount of time in between each vaccination. You cannot argue that if a mother does not test positive for hepatitis B during pregnancy, that there is no reason to give a baby a hepatitis B shot because they are virtually at no risk of getting that disease at that age. Pretty much everything that Trump said and RFK and all of those people said in that meeting was common sense. It's just a matter of whether you want to have common sense or you just want to hate Trump no matter what he says. So all I'm saying is, like, be open-minded, okay? Be willing to give something else a try. If we're unsatisfied with the way that the system is set up now and somebody is giving you an option with virtually no risk, why would you not try it? At the end of the day, if it doesn't work, if things don't improve, fine, we'll try something else. But at least we have someone in this cabinet, in this administration, that is willing to try, that is willing to search for answers that no one else is looking for. And as an autism mom myself, I think I can speak for plenty of other moms when I say that a lot of us are happy that someone is finally asking these questions and not just ignoring us. So if you want to down your Tylenol, that's on you. That's your choice. Just know that before Tylenol was invented, before Advil, before ibuprofen, before any of it, there were natural remedies that treat headaches, okay? And they still exist, and you still have access to them. That's just my suggestion to you. You can take it or you can leave it.
All right, so I got my hands on the letter the FDA sent providers regarding Tylenol and autism and ADHD, and it does not read like that press conference. Let's go over it. In the first paragraph, it's basically telling you what they said from the podium, but when acetaminophen is taken chronically throughout pregnancy to childbirth, not a lot of people do that, but it gets interesting in the second part. To be clear, a causal relationship has not been established, and there are contrary studies in the scientific literature. This third paragraph is my favorite. In the spirit of patient safety and prudent medicine, clinicians should consider minimizing the use of acetaminophen during pregnancy for routine low-grade fever. What's a low-grade fever? Here's the best part. This consideration should also be balanced with the fact that acetaminophen is the safest over-the-counter alternative in pregnancy among all analgesics, and antipyretic aspirin, ibuprofen have been well documented to have adverse impacts on the fetus. So this is a giant nothing burger because they're basically like, oh, you should minimize it, but like definitely still use it because it's the safest. WTF, bro.
I'm a pharmacist, my wife's pregnant, who's also a pharmacist, and I'm going to tell you why we will still continue to take Tylenol. One of the biggest concerns that Tylenol will help out with in pregnancy is fever. If that fever goes untreated, you increase your risk of having a miscarriage, birth defects. Even further, it can put you in the ER. And if you know anything about an ER, that is a brooding ground for illnesses, which is where you do not want to be if you're pregnant. Then there's also pain. Unmanaged pain doesn't just make you uncomfortable, but it puts stress on your body. And that stress can actually raise your blood pressure. High blood pressure in pregnancy can increase the risk of preeclampsia and placental problems, which can even restrict the baby's growth. That stress over time can also lead to premature birth and birth defects. So my takeaway is this: Tylenol, when used effectively, is still one of the safest medications you can take in pregnancy. The real danger comes from not treating these issues and not the medication itself. I urge you to listen to experts on this one.
I've seen too many videos today of pregnant women downing Tylenol, I guess in an effort to own or spite President Trump. Let me show you just a few.
Take Tylenol for my headache while pregnant because I don't take my medical advice from a man who doesn't have a degree in science, healthcare, or medicine.
Imagine hating Trump more than you love your own child. Also, what are the odds these people who talk about believing and trusting the science believe that men can get pregnant? Because this is the Assistant Secretary of Health under the previous administration. Like, y'all were taking advice from a man who thinks he's a woman. If you watched the press conference where Trump talked about this, like I did yesterday, Trump very clearly says, talk to your doctors, let them advise you, make your own choices. If you can refrain, you probably should, but if you need to take Tylenol, do it, but not in excess. And it's not just Trump saying that. This is a study from Harvard, the bastion of liberalism that is Harvard, okay? And here's a study from Johns Hopkins. All Trump said is that autism rates and the usage of Tylenol during pregnancy are linked. He didn't say it's the only thing that can cause autism in children, and he didn't say it's a guarantee that it will cause autism. If Trump says that oxygen is good, I am convinced that there are people out there who would suffocate themselves.
If you are the parent of a child with autism and you happen to take Tylenol during pregnancy, I want you to know that you did not cause your child autism. If you are pregnant right now and considering whether Tylenol is safe in pregnancy, I want you to know that the best available science does not show an association between Tylenol use in pregnancy and an increased risk of autism. I'll put more in the caption below.
Hey guys, it's Dr. A, and I had to pop on here to talk about this whole Tylenol and autism link. I'm a pediatrician and allergist in Toronto, Canada, and I'm also postpartum. I just had a baby a month ago, and I look chaotic, but I've been just watching what's been going on. I've been trying to take a little bit of a break from TikTok and social media while I spend time with my newborn, and I've been developing content in order to ensure you guys are always having things to learn. But I had to make this original content and while my baby's sleeping because I think it's a very important topic. First of all, pregnancy, as someone who just gone through it for the last 10 months, is very hard, very challenging. And not only is there lots of things psychologically that affect you, the way your body changes, but pain is definitely a part of it. I personally suffered from things like reflux, sciatica, I had lower back pain. I also got sick in my first trimester. And so Tylenol was something I definitely took. There's already so many limitations on what you can do when you're pregnant and what medications you can take, and Tylenol is one of the ones that are considered safe. There have been many studies. There's not a link of Tylenol and autism, and I think it's important that we're not creating fear in pregnant women and, you know, having them not only go through what they're going through, but on top of that be like, hey, if you're in pain, too bad, so sad. There's so many confounding factors, like when you're sick and you have a fever, you know, is that something that can link to changes in your baby's neurodevelopment? Autism is not caused by one certain thing. It's multifactorial, it's genetic and environment and many things at play. So I do not want moms out there who are, you know, in pain to be like, oh my gosh, I'm going to continue suffering. Or if they have a fever, I'm not going to take Tylenol because this is potentially going to cause autism. It's very frustrating to hear people who have a lot of power and influence spill misinformation out there. And I think that because as someone who's been watching this in the background and have been trying to focus on my newborn, I just had to PSA out there because it's wrong to do that. And women are already going through so much, and also, you know, to target patients who are affected with autism as something like it's bad. You know, patients with autism or kids who have autism are amazing kids. I have lots of patients that are affected, and honestly, they're hilarious. They have their own unique personalities, and it's not something you should be like, oh my God, it's so bad. All children should be loved. Tylenol's good for you during pregnancy if you need it, and you shouldn't be scared of it.
Some doctors say be cautious. They point to studies suggesting a possible association between prenatal acetaminophen use and higher chances of autism. They advise don't panic, but limit use to only when truly needed and always under medical guidance. Other professionals are reassuring moms that the science is not settled. They explain that these studies only show patterns, no direct cause. Millions of mothers have safely used Tylenol for decades, and leading groups like the American College of Obstetricians and Gynecologists still consider Tylenol the safest option when used as directed. This is about trust. On one hand, you don't want to take chances with your baby. On the other hand, stress and untreated pain can also harm both mother and child. That's why doctors stress balance. Don't self-medicate out of fear or out of habit. Instead, make every decision with your healthcare provider. It reminds me of Psalms 34 verse 4. I sought the Lord and He answered me. He delivered me from all my fears. Fear is natural, especially when life is growing inside you, but fear should push us to seek wisdom, not panic. To all the expecting moms watching, what do you think? Do these lawsuits make you less confident in using Tylenol, or do you still trust the medical advice you've been given? Let's talk in the comments, and if you want more clear fact-based commentary on news that affects family, subscribe and stay tuned. At the end of the day, the Tylenol debate is less about fear and more about informed choices. Keep asking questions, keep seeking truth, and keep protecting both yourself and your child. I'm Njoroge. Until next time, stay safe and stay informed.